If I had to lose my counseling services or if I had to switch, I would be completely devastated. That's the support system that I've had for the past 3 years that I've worked so hard to build, and it involves so much trial and error that to have those resources taken away from me for any context, it would be like my entire world was falling apart and I probably wouldn't know what to do.
We were poorly funded and not well integrated for a long time. That was before the whole behavioral health shakeup of closing down most of the system and bringing in new providers from Arizona. That made it so much worse. The system and services for individuals has not recovered.
I believe a lot of people lost services during that time, and probably still to this day there's lack of services behind what has happened.
I don't think that medication is the solution, but some psychiatrists say they just want to diagnose you in less than 2 minutes. They haven't even talked to you for 30 minutes and they already diagnosed you with so many stuff, and then all these pills, and most pills give you side effects.
There's still nobody available to give Medicare services, hardly any, since that 2013 shutdown. I have people coming to see me that have to travel 2.5 hours to come and see me because they can't find anybody in their area.
All of a sudden, we had people in our field, the mental health field or the health field in general, start losing a lot of jobs and funding started decreasing. For us, it's been about watching people who are great people, well-trained, well-educated, capable people, not be able to help the New Mexicans that need the help.
New Mexico has a manito culture. We're manitos, and we treat each other that way. And that's the perspective we need to help solve our problems.
If there was more people available to provide services to people, and they could afford to go to those services, then people would be healthier.
I think the ideal outcome for New Mexican families would be just a simple notion that healthcare is affordable, it's accessible, and there is no cultural stigma towards it.
Instead of putting more money on people going to jail and doing all these extra laws that don't need to be done, we should open up LGBTQ youth shelters and for treatment centers to be better, for treatment centers to really help you out.
A message to the Secretary of State or decision makers at the Department of Health from us at Agora: we'd honestly like to be included more. Being integrated into the pre-medical system or the early medical system, the mental health system would, I think, really change things in a tremendous way.
An ideal behavioral health system in New Mexico would be one that was integrated in with other services so that physical health, primary care, physical health, behavioral health, that they're part of a team and working together, not in a silo. So integrated within school systems, within juvenile detention and prisons, within the healthcare system. Behavioral health services need to be integrated, accessible, well-known, and part of a comprehensive team approach to whatever someone needs.